Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Allied Healthcare Scholarship Program informational webinar. Before we begin, we want to make sure everyone knows who this webinar is for. Today's webinar is for new and continuing applicants to the Allied Healthcare Scholarship Program, which increases the number of appropriately trained allied healthcare professionals providing direct patient care in a qualified facility in California. Here's the agenda for today's webinar. We'll start off with the housekeeping and introduction. From there, we will move to the Office of Health Workforce Development and Allied Healthcare Scholarship Program overview. We will then jump into the program elements and key dates, followed by the application cycle and program eligibility. We will have a question and answer session at the end of the webinar, and then we will close things up with some closing remarks. Let's go over the housekeeping items. Number one, this webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the camera, the microphone, the chat, and the view controls in the menu at the top of your screens. Number two, the chat option will be open for asking questions during the Q&A session, which is, as we mentioned, at the end of this webinar. Number three, this webinar will be recorded and will be available within 7 to 10 business days on our website. And with that, it is my pleasure to introduce Hovik Khosrovian, the Senior Policy Advisor for Health Workforce.
Hey, good afternoon, everybody. Thanks for being here. Really appreciate everyone's participation in today's webinar on the Allied Health Scholarship Program. Really excited to introduce this to everybody, give them updates and some discussions and go over the application. So with that, I'm Hovik Khosrovian with HCAI, Health Workforce, Senior Policy Advisor. So I'm just going to do a quick brief introduction of HCAI. I'm sure many of you hopefully are familiar with us. For those of you that are newer to HCAI and what we do, just give you some background on who we are and all the different programs we really focus on for workforce development. So HCAI as a whole, we're a much larger organization than just workforce development. We have many other things that go on, whether it's Office of Healthcare Affordability, our distressed hospital programs, our data programs with the hospitals and clinics, as well as multiple other programs within HCAI itself, including facilities. So overall, we have our HCAI's vision and mission really are dedicated to ensuring Californians have access to care. So with our vision, our main focus here is a healthier California where all receive equitable, affordable, and quality health care. It's key to all our programs, as you'll see, especially including with this program with Allied Health, that we ensure everyone that can get access to providers has it, as well as individuals that are interested in pursuing careers and health workforce have the opportunity, regardless of the ability to support financially or have access to from where they are to be able to pursue these careers. The mission as well for our organization is really to expand equitable access to quality, affordable healthcare for all Californians through resilient facilities, actionable information, and the health workforce each community needs. And that's really a combination of all we do at HCAI, from the very beginning of ensuring facilities are safe, all the way through ensuring those facilities have individuals in the workforce there to really support the individuals at all levels of care. Go to the next slide. So in workforce development, we have a few key goals and ideals that we really try to follow within all our programs. So as in workforce development, as the state's central health workforce entity for really supporting and collecting data on workforce development, we have three main goals here. We try to work to expand the health workforce that serves medically underserved areas, so all areas that don't have access to services, regardless of whether they're in urban settings, rural settings. We really focus on ensuring there's enough providers for everybody in all those geographic locations. Another key focus is ensuring that Medi-Cal members have access to providers at all levels, from primary care to oral health to behavioral health to nursing. We really want to make sure that everyone has access and it's adequate for them. And then lastly, and kind of the underlying goal of everything we do at HCAI, it's a huge key goal within state and in Health and Human Services, is really to ensure that the workforce that's supporting Californians represents them as well. So that's through racial and language diversity to ensure that if you go to see a clinician, they understand your cultural background, they understand where you're from. They're also from communities similar to yours, and they have that experience and know how to really help you and communicate, understand your needs. So that's one of the key goals that we have within all our programs. And we do that through various different ways. And there's 4 key ways we do that. One is to really help organizations build that workforce pipeline. So we have programs that really help increase the number of individuals from early on from high school and up to be really interested in health careers. And then we're there to really help expand on the organizational side, the capacity for education. So we work with schools and training programs to really expand how many people they could take in and serve and teach, as well as ensure that they're really focused on communities that really need that education capacity. So having that access again available to communities that normally don't have either training programs or schools, really expanding in those areas. And third is really helping individuals pursue health careers, and that's where we talk about financial support, programs like these scholarships and our loan payment programs to really allow anyone that wants to be a health worker to really be able to access it, regardless of their financial abilities. And then lastly, really helping organizations support providers and addressing retention. So really focusing on what we can do to help organizations keep their employees and their workforce, as well as grow them and upskill them and really help them get to that next level of a workforce professional and better their lives. That's really the key goal of our programs too. So really excited because the programs that we're going to talk about here is really connected to all of these goals and objectives. So next slide, please. So now I'll hand it off to Michelle, who's going to be talking about the Allied Health Scholarship Program, and really excited because you're going to see a lot of those elements that we talked about for what we try to do within our organization. Thank you.
Thank you, Hovik. My name is Michelle Crouch, and I am one of the program officers who works in the unit that oversees this program. And I'll be going over the program elements, the key dates, the application cycle, and program eligibility. Next slide. An overview of the program. The purpose of this program helps support students who are dedicated to providing health care in medically underserved areas in California in exchange for a 12-month service obligation. Its goal is to increase the number of appropriately trained health professionals providing direct care and encourage them to provide health care in California's health professional shortage areas. Next slide. The program has currently, applicants must be currently accepted or enrolled in one of the programs that are listed here on this slide. And those highlighted in yellow are our newest, the International Board Certified Lactation Consultant and the Degree Nutritionist and the Registered Dietitian, in addition to all these other programs. Next slide. This program receives funding from special funds and/or donations from both individuals and organizations. The maximum award amount for a scholarship is $15,000. HCAI may award full, partial, or no funding to an applicant based on the applicant's success in meeting the selection criteria and the amount of available funding. Applicants will not be awarded more than their total cost of attendance for 1 year of the program. Applicants can apply as many times as they would like, and for every award that they receive, their service obligation would increase by 1 year. And if awarded, grantees will receive a one-time payment at the time that their contract executes. Next slide. The application cycle opened on November 1st and will close on December 13th. Late applications are not accepted and there are no extensions or exceptions. Applicants must complete the online application and must provide all the required documents at the time that they file their application. The required documentation includes a conflict of interest letter, if applicable, the scholarship program verification, and a cost of attendance verification for 1 year. All applications are reviewed by program staff, and only those eligible applications will move forward to be scored. Next slide. There are many reasons that an application may be disqualified, and they could be the application is missing required documents or information. A person may not be enrolled in the minimum number of units. The cost of attendance is incomplete or not an official document. Not enrolled or registered in a program, or the program itself is not eligible. Required documentation could not be opened or viewed. This happens a lot of times, and it's very important that when you file your application, make sure that that document that you attach can be opened, can be read. Applicants that have an existing service obligation are not eligible, and any application submitted after the deadline will be found ineligible. Next slide. The program must begin by October 1st, 2024. A minimum of 6 units or its equivalent until program completion. You must maintain a grade point average of 2.0 or greater. You must graduate after March 30th, 2025. And you must be free of any other service obligation, which includes those other HCAI programs. You must not be in breach of any previous HCAI contract, and you must commit to serving a 12-month service obligation, working in a medically underserved area upon graduating, and you must provide 32 hours or more per week of direct patient care at a qualified facility within 6 months of graduating. Next slide. For a facility to be eligible, it must be in one of the following eligible geographic or site designations. And that they can include your dental, primary care, and mental health professional shortage areas, medically underserved areas, state or county health facilities, rural healthcare centers, your federally qualified health centers. The list is pretty extensive. Next slide. If awarded, grantees will be required to submit a graduation date verification form within 30 days of graduating. Over the course of a 12-month service obligation, the grantee will have 2 progress reports to submit, which must be signed by the grantee and their supervisor. And what that is, basically, it confirms that they're providing 32 hours per week or more in direct client care during the given reporting period. Any changes regarding employment must be, you must contact the program officer. It could be maybe your hours are changing, or you would like to go to a new employer. And I would suggest that you reach out to your program officer prior to accepting employment at another facility. You want to make sure that that facility qualifies. If the grantee requires time away from their work site and that time goes beyond 4 weeks, which we allow, then that extra time would be added to your service obligation and we would amend your contract. Next slide. Last year, we had 157 eligible applications. Of those, 63 were awarded and 94 were not awarded due to not enough funding. Next slide. Okay, and before I turn it over to Chris for questions and answers, I wanted to remind you that the Allied Healthcare Scholarship application is being translated into the top 5 threshold languages, which are Spanish, Chinese, Tagalog, Vietnamese, and Korean, and will be posted to the site approximately 1 week from the cycle opening. So keep checking back for the added links. Also, if you're trying to reach the program officer and you're not having luck, you can always reach Wahida Nahib at she's the section chief, and her email address is wahida.nawab@hci.ca.gov. And with that, I will turn it over to Chris for our questions and answers.
All right, thank you so much, Michelle. As you can see, your team has put a lot of work into this program, and we're excited that you've joined us today to learn more. We are going to transition to our question and answer session, and the chat option is now accessible in the menu bar at the top of your screen. If you are unable to access the chat feature or still have questions after the webinar, please email your questions to hwdd-sch@hci.ca.gov, and you will find that email address in the chat along with the rest of the links that you'll need for this program. And today we're actually going to start off with 3 questions that we've been already receiving, and we're going to answer our 3 most commonly asked questions, and then we will go to the chat. So Michelle, take us away with those 3 questions. Oh, Michelle, you're still muted.
Okay, you can hear me now, right?
Yep.
Okay. Are WIC agencies located in local administrations eligible as a practice site? The answer is county health offices, city health offices, hospitals, and nonprofit organizations that provide WIC services are eligible under the facility designation type, such as county facilities and nonprofit facilities. Practice sites are also eligible if they are located in an underserved area, which can be identified through this website. And that would be https://geo.hci.gov/HPSA-search. If an applicant is unsure if their practice site is eligible, they can contact the HCAI program staff for technical assistance. And the second question is, does the scholarship cover the costs of the national certification exam for registered dietitians or International Board of Certified Lactation Consultants? And the answer is the scholarship award supports the costs of the education and training for students enrolled in an eligible program. Applicants that have completed their education or training requirements and are no longer enrolled in that program would not be eligible for the scholarship award. And the third question, how are accredited education training programs defined for RDs and IBCLCs? The answer is education training programs are considered eligible for the scholarship program if they have received accreditation from a state or national accrediting body for those degrees and/or professions. Applicants should verify prior to applying for the scholarship program if the education or training program they are enrolled in or will be enrolled in has accreditation from a state or nationally recognized accrediting body and be prepared to provide confirmation to HCAI.
All right, thank you, Michelle. All right, so we're going to jump into the all of your questions in the chat, and the first question is from Shantasia. Shantasia asks, I did not see nursing as an accepted program. I am just confirming that it is accepted.
Nursing, we don't believe have any nursing programs under the allied healthcare. It's not, nursing is not really an allied profession. We do have our nursing scholarship programs though, for BSN, your associate's degree nursing. And those are actually open right now also.
Yeah. And we would encourage you to take a look at our scholarships page on our website, and you will see the nursing programs that we have, as Michelle mentioned there. So, all right. Next question. Beth asks, how many degreed nutritionists last year were awarded this scholarship?
I don't have that answer for you. I know that it's, as it is now, it's a new program. Last year we would have had, I believe it was the nutritionist / dietitian is what the program was. And if you put an email in the chat, I can look that up for you and have an answer to you after the webinar.
All right, thank you. As Michelle mentioned, Wahida Nawab is the section chief, and so when you do ask questions, you can find her email there if you do have questions and concerns beyond just your normal questions, which we would ask you to use the HWDD dash SCH at HCAI. All right, next question. Let's see. Where do I find the cost of living form or the cost of attendance form? Excuse me.
I believe that would be found. You can get that at the program you're enrolled in.
All right. Another question on nursing. Again, for all those looking for our nursing programs, go to the scholarships page on our website, and you will see the nursing programs that are open right now as well. So, let's see. Hannah, I see your question saying with curious about the following, but then there's nothing left, nothing following that. So if you still have questions, make sure those get in the chat. Angelica, I looked into applying and it's telling me that I don't have access.
You don't have access. You're not able to. I'm not sure I follow you.
Imagine as they're going into the EAP portion, they're not finding access.
Okay. If that's the case, I would go ahead and reach out to me. My email address is Michelle, MICHELLE.CROUCH at hci.ca.gov, and I'll walk you through it. We'll figure out why you're not having access.
All right. And just a note, Alma did post all of the other scholarship links in the chat. So if you are looking for a different scholarship, just search through the chat and you'll see the links for all of those chats. Thank you, Alma. Let's see. Where is the link? Again, that's in the chat. Just scroll through the chat and you'll see all of our links in there. Are we able to get a copy of this presentation? Yes, you are. On our website, there is a link to it, and it's also linked in the chat on that. And then we will have a recorded link, a link to the recording posted within 7 to 10 business days once we get the captioning and make it accessible. So within 7 to 10 business days, you can go back to our website and find the recording of this webinar. All right, what are some examples of underserved areas across California?
We have your mental health shortage areas, your dental, primary care, your medically underserved areas. Those are, certified by HRSA. I'm not sure if that answered your question. Rural areas are shortage areas.
And I believe on our website, there's a tool to help you find other underserved areas.
There is.
And if we can get that link posted in the chat as well, Alma, that would be amazing. Okay, let's see. Next question. Do I qualify to apply as a master's student who graduates in May, studying to be a registered dietitian?
You would, because you have, as long as you graduate after March, then, and it's an eligible program, you would qualify.
All right. Next question. If my educational program has not started yet, because it can be started at any time as it is a training program, can I still apply?
You would have had to start by October 1st. You would have to be enrolled by October 1st, and that would be on that verification form. So if you're not enrolled now, chances are you're not going to qualify this round.
All right, thank you, Michelle. Julie asks, does an eligible facility have to be a brick and mortar clinic? I work with a mobile healthcare provider for unhoused people. Would that be acceptable?
Good question. So mobile, you're completely mobile. The actual facility must have a headquarters office, I would imagine. It's a question. This is a question that needs further discussion on. So I gave you my email address. Send me an email and we can discuss that.
All right. So go ahead and send us an email, Julie, and we'll help you out in that situation. All right. Next question. I currently work in healthcare and I'm going to community college. Am I able to apply?
You must be enrolled in an eligible program that was on that one slide by October 1st. If you are, then you would be eligible to apply.
Go ahead and take a look at that eligibility program eligible list, and we also have our eligibility tool, which can help you work through whether you're eligible or not, and that is in the links. All right, for the nutrition degree, can the school be from another state, like an online school?
Yes, they can. For all of our scholarship programs, they can be out of state schools. They can be online as long as they're accredited.
All right, and here's Hannah's questions. Number one, is it worthwhile to apply if the applicant only speaks one language? Number two, well, let's just do one at a time. Is it worthwhile to apply if they only speak one language?
Most definitely. It would you would be wise to apply. And within a week, hopefully we'll have the application translated into those additional languages.
All right. Second question, if I'm graduating in 2026, should I wait to apply next year?
You might want to wait, only because I know that the way that the application is scored, depending on how long of a period that you will be graduating, you might receive a higher score. For instance, if you were to apply now, but you're not graduating for another year and a half, you might not get as many points as if you were to wait. Okay, if that makes any sense.
Then the last question is, can I apply this year and again next year if not accepted?
Of course, yes.
I would say go ahead and apply, Hannah, and
definitely.
It does not hurt to apply.
Does not hurt.
Okay, next question. Can students enrolled in ADN programs qualify for the scholarship? We have a separate program for ADNs, correct?
Yes.
Yep. Go ahead and
any nursing professions you want to apply under the nursing scholarships. Allied healthcare does not cover the nursing. Now it does have your like pharmacy technicians and your dietitians, but actual nursing professions would have to go to our scholarships for nursing specifically.
Okay. Rosario asks, what if I'm currently working at the hospital? Is it credited?
Okay, say that again.
What if I am currently working at the hospital? Is it credited? I'm assuming, do they get credits towards that as?
Yeah, no, you don't get credit for the service obligation until you've actually graduated and then are working. Any prior employment will not count towards a service obligation for the award that you receive.
Next one, currently in community college, received WIC, and my major is BSN. That one also falls under our nursing programs. Go ahead and look for that. Let's see. Marisol asks, I have a concern due to COVID-related pandemic. I was put into a per diem position and then had a medical concern. So my program director said my only choice was to sign a breach of contract. Who could I contact to look into what can be done, as I am interested in pursuing the IBCLC and would like HCAI assistance?
Send me an email, michelle.crouch@hci.ca.gov, so we can discuss that further.
All right, Marisol, we'll look forward to hearing from you to be able to help. Thank you. I currently work for WIC in public health. Am I able to apply?
Public health. If you're enrolled in an eligible program.
Anson asks, are there any restrictions for education or training? For example, I am a post-bac student and unsure if I would qualify.
Our website has the eligibility quiz. You can use that. But as long as you're enrolled in an eligible program, then you would be able to apply.
And again, that link to our eligibility tool is in the chat, and that will help you see what programs you do qualify for and don't. So Daniel asks, I would like to go to paramedic school. I'm not currently enrolled because I don't have the funds. Can this program help? I'm an EMT with 22 years of experience. How could I work in underserved areas?
You want to get enrolled in a program. You would have to wait till next year because obviously you're not enrolled. You did not enroll by October 1st, but definitely enroll for next year. We do have the paramedic program.
All right. We look forward to seeing you next year, Daniel. Lori asks, medical assistance program is accelerated and ends in February 2025. Is this still eligible?
And send me an email. I will have to check into that for you.
All right. Thank you, Lori. Ernesto asks, can students enrolled in entry-level master's programs in nursing qualify? You graduate as a nurse practitioner. Again, look at our nursing programs there.
Yeah, one for nurse practitioners.
Yep. And again, all of the links, look through the chats and you will find they're actually the main set of links are actually pinned to the top, and you can see those at the top, and then all of the rest of the links that we've talked about are in the chat, and so you just have to go through that, and you'll find all of the links that we've mentioned here today. Do these educational programs have to be located within California?
Say that one more time.
Felicia asks, do these educational programs have to be located within California?
They can be online. They can be on, do me a favor, send me an email. I will double check on that just to be certain.
All right. Lori says, I've completed my IBCLC certification. Will this scholarship cover the exam?
No.
All right. Let's see. Lots of confusion on the nursing issue. So again, those links for all of our programs are in the chat. Is the scholarship just for the state of California or any state?
State of California.
You have to be a resident.
Yeah.
All right. I have a question about the eligible disciplines. It's only those that are those three highlighted programs. Also, do we have to be in school right now to get into one of the programs listed? I am a nationally certified phlebotomist, would be eligible to apply to another program. Couple issues in there.
If you're already a phlebotomist, then you wouldn't want to enroll in a program, and we don't have a loan repayment program right now for that profession. So it doesn't sound like you would want to apply. Now allied healthcare loan repayment program. If that comes back around to us, down the road, that's something that you might want to look into and apply to that program.
And just to clarify, the 3 highlighted programs in the list were highlighted because they're newly added to the program.
Yeah.
The entire list, everything that was listed on that list is eligible. All right, Yesenia asks, I work as a nutrition assistant at WIC and plan to go for my IBCLC, but I have not started taking any courses yet due to funds. Can this program still help me? I have been at WIC for almost 8 years and was hoping to get help paying for the coursework in the IBCLC exam.
Obviously, you're not enrolled this year, so enroll and then apply to the program next year.
And then can these funds be used for recertification for the IBCLC?
Send me an email and I will get back to you on that.
Right. Samantha asks, so to clarify, someone would need to be enrolled in an actual IBCLC training program versus just doing the coursework and obtaining clinical hours on your own. We have breastfeeding peer counselors that can get clinical hours at work and through their peer counselors' work, but it sounds like they would need to enroll in an accredited program.
Correct.
That is correct?
Is correct, yes.
Okay. Yeah, your audio broke up for a second there.
Okay.
Yep, no worries. Vanessa asks, do you have to have started the program by October in order to qualify for the scholarship? Yes. How about a public health position such as a public school wellness coach?
Now we have other programs that wouldn't be covered under the allied healthcare.
All right. Emily asks, I've applied for radiology tech program that starts in January and I'm still waiting for approval. Can I still apply?
Not this year.
We look forward to seeing you next year for next year's application, Emily. All right, Destiny, if I am applying for the scholarship and I'm in the middle of applying for graduate school, how do we go about giving verification to HCAI?
The verification form from the school for the program that you're enrolled in will be one of the documents that you upload.
Let's see. Rosario asks, I've completed my EKG technician and am applying for medical assisting. Am I eligible to apply?
As long as you're enrolled by October 1st in one of those eligible programs, then you would be eligible to apply.
All right. I start school in January for food and nutrition program. Would I qualify? I have been admitted already since August, September.
You're enrolled by October 1st in one of those eligible programs, then apply.
Okay. So it is enrolled, not classes started.
On that verification form that you'll get from your school, it will have on there the date that you enrolled or, enrolled in the program, and then your anticipated graduation date.
I have a BA in business. Could I apply to get the degree nutritionist?
You would probably want to check with the program that you want to enroll in, and the counselor would let you know. But obviously, if you're not enrolled by October 1st, you can't apply this year. You'd have to wait for next year.
Okay. Lee asks, hello, how many doulas were awarded the scholarship last year?
And you'll have to send me an email and I'll get that information for you.
Can I apply for the scholarship if I have DACA?
What was that?
DACA?
Okay. Send me an email. I'll have to look into that further for you.
All right, Blanca, go ahead and do that, and we will be happy to help you out. Okay. Lee asks, the students received the Wellness Coach Scholarship this year. Are they eligible to receive an Allied Health Scholarship? Would be a no, right?
No.
Oh.
That would be an overlapping service obligation.
Okay. And
glad to hear that you're enrolled, a wellness coach, because that is a wonderful thing to be in profession.
Yeah. And we're so glad that you were able to get one of the scholarships. For those that do need to email for questions, Michelle's email is right there in the chat. Let's see. If I'm attending community college and they are offering just free tuition through the California Promise Grant, can I still apply for the scholarship?
That's not considered an overlapping service obligation, but you would have to wait for next year because you're not enrolled in the program as of October 1st this year.
All right, and very similar question, just City College of San Francisco, and they're covering the tuition. Can they be eligible for this grant to help pay for scholarship and other for rent and other expenses?
Scholarship is to cover the cost of attendance for being enrolled in the program. I don't believe that it covers your rent.
All right. Let's see here. Some more nursing questions. Again, you can look at the website for the nursing programs that we offer. And again, if you were not enrolled by October 1, you're not eligible this year, but come back for next year's cycle. Which brings us to this question: is this scholarship once a year?
The cycle opens every year, as long as there's funding.
All right. I have a professional lactation course that has been recognized for CERPs through International Board of Lactation Consultants Examiners. Will this qualify for your program?
As long as you're enrolled by October 1st in that lactation consult program. And the best person to ask would be the counselor there, where you're enrolling at.
Wiley asks, is the X-ray program acceptable?
Which program?
X-ray program. X-ray technician?
The X-ray technician, yes.
All right. Felicia asks, will the Golden State Social Opportunities program application open up again this upcoming May?
That is a different program. I'm not exactly sure. Go to our website and look up under that particular program.
And then there is the link posted by Alma for searching for the shortage areas and also the funding eligibility, if that was something that you were looking for. Can we please pull up the slides on the eligible programs again? Sure. Go ahead and pull up, there we go. And again, as we mentioned, the three highlighted are highlighted because they are new programs added this year. So if you have been applying in the past and you seeing those for the first time, that's why. All the rest of them are still eligible programs. Okay. Opening registration. I think this we will be opening registration soon for a 2025 training calendar. If students are enrolled, will this qualify for the scholarship? I think since it didn't meet the unless it's the October 1st deadline, looks like it'll be next year. Let's see. Janice asks, for professional information for the application question about working in a medically underserved area. I have worked in the area as a case manager prior, but currently in an MRI program. Would this matter to mention in the application?
No, it's always a good thing to mention things like that. Definitely.
All right. Next question. What if you're going back to school and cannot finish the 12-month service obligation?
You definitely then don't sign the contract. If you don't think that you'll be able to complete that 12-month service obligation, you don't want to sign any contract because there are penalties. Okay. You are given the award up front. And if down the road you cannot complete that service obligation, we will work with you any way that we can. If you need an extension, we can give you up to 6 months. But definitely, you do not want to breach your contract because you can never apply again to any of our programs. You'll be on the hook for penalties and then have to pay back any money that you received. And on scholarships, you receive that money up front. Okay. So, yeah, you do not want to breach.
All right. Next question. Why is the start date for program October 1st?
I don't have an answer for you on that one. That I do not know. You can send me an email and I'll try to find out for you.
All right. Deshaun asks, do doulas qualify? Yes, doulas are on our list. All right. Let's see. Amanda asks, I am in a dental hygiene program at a community college. Do we have to work any amount of hours for free, or is it just 12 months of paid work? I just want to be clear about that part.
Paid or volunteer I know some of our programs have volunteer. I would have to find out for sure for you. So send me an email and I'll find out.
All right. Guadalupe asks, at work, I work at WIC. Can that be? There we go. Thank you, Guadalupe. I work at WIC. Can that be qualified for the obligation time after graduating?
Yes, it can be.
Fantastic. And it's great to see all these WIC the WIC people here in our webinar today. We're really glad to have you all. Tara asks, I'm a medical assistant. Will I qualify?
You must be enrolled in one of these eligible programs by October 1st, and then you would be eligible. You would want to apply.
Sean asks, do MFT or LPCC programs qualify? We have separate programs for behavioral health, and you'll want to go ahead and look on our website for our behavioral health programs as well.
Also have the licensed mental health program that covers
right.
the LPCCs, yeah, or MFTs, yeah.
All right. Will there be another application cycle, and if so, when?
Next year. It's a yearly cycle.
Yep. All right. Let's see. Lots of questions about do doulas qualify? Yes, doulas qualify. Let's see. Rosario asks, how can I get a scholarship for medical assisting? Medical assistant is a qualified
program. Yeah.
Program. Just have to be enrolled. Let's see. I'm not seeing any links came in late. Okay, that's interesting. If somebody came in late, they might not see all of the links that were posted before they came in.
Mm-hmm.
Okay,
we
will repost those for you. Mm-hmm. That's good to know. Hannah says, thank you so much. I appreciate the helpful answers. Thank you, Hannah, for showing us some love. We're here. We do these webinars so that we can answer your questions and make sure that you guys have the best opportunity as possible to be eligible for these funds. Let's see. I'm a CNA working at acute hospital, going to community college. That's a nursing question. See our programs for nursing on that.
We have certified nursing assistant as a program here. That is the one exception. So if you're enrolled in a certified nursing assistant program by October 1st, then you can apply.
All right. But if you are going for your RN, as it looks like, then look into
BSN.
Yep.
Yeah.
Let's see. I enrolled in the IBCLC program, but it starts until April. Can I apply this year again? The October. Well, if they're enrolled, right?
They're enrolled by October 1st.
Yep. Okay. There's some of the links. Let's see. So what I'm understanding is that I would have to be enrolled into a program when I would be applying for the scholarship. I can't be finished, then apply, correct?
Correct. Yeah, you have to still be in school. We have loan repayment programs for when you are out of school and working.
I already started my program in August. Can I still apply?
You're already enrolled, so you would be able to apply as long as you do not graduate until after March 2025.
Okay. I'm currently in the SFSU internship program working on my master's and registered dietitian title. May I apply?
If you're enrolled by October 1st.
Okay. We must be enrolled by October 1st, 2024, right? Not 2025?
Correct. 2024.
Okay. How many dental hygienists were awarded last year?
That I would have to look into for you. So go ahead and send me an email, and I'll get that information for you.
All right. Okay, let's see. I am in my last year of radiology tech program at community college, 2 years, and I began 8/7/23. I would work in a qualified area upon graduation. Check the eligibility site, and it already says that I qualify. I just want to know if there's any additional forms I can submit to get additional points for the scholarship to have a better chance of being a funded applicant.
Are you working now? Are you working now in a health professional shortage area? I would want to know that. And as long as you're graduating after March of 2025, then you would be eligible to apply.
All right. Let's see. Keisha asks, if we don't qualify this year, can we be placed on an email and receive an email for next year's application?
Get on our mailing list.
Yep. And we'll talk about how to do that at the end of the webinar, how to get on our mailing list and receive information on all of the programs that we have coming up, including this one. That's a great question. All right. We are running out of time today. We have a lot of questions.
That's great. Very good.
So let's see. We've already answered a lot of these questions, so I am going to skip through for questions that are new and that we haven't answered yet. Yesenia asks, will it cover the cost of my future IBCLC exam as well, not just the cost of the program attendance?
It's the cost of the program that you're enrolled in.
All right. Where would a paramedic work to fulfill the 23-hour requirement?
32 hours?
Yes.
You can, in one of on that one slide where it lists the eligible locations, and if you have questions about it, you can always reach out to us. We can check the specific address to see if it's in a shortage area or if it will qualify. I would definitely reach out, contact us.
All right. Are we paid for the 12 months?
Well, when you're working, yeah, you would be getting paid through your employer. So, yeah.
All right. Paula asks, how much funding is available for this cycle?
Question. I'll have to look into that for you. I don't have the numbers off the top of my head right now.
All right. The one-year service can be from any of the eligible geographic and site destinations listed on the grant guide page 4, ? And I heard the service can be both paid and volunteer as long as we meet all the requirements within the year of service. Is that correct? Was all that correct, Michelle? Sorry.
Correct. Yes. Sorry about
Okay.
that. Yes.
We had a sound drop out again there.
Okay.
How do we verify our service?
Verified that you're completing your service obligation from those 2 progress reports that will be due throughout the 12 months, one after 6 months and then a final one. And you sign off on that report, and then your supervisor does too, confirming that you are meeting the 32 hours per week of direct patient care in an eligible facility.
All right. And one last one here. I'm trying to apply it says I don't have the appropriate permissions.
So another access problem, huh? Reach out to me, send me an email, and I'll get on that. Yeah, those are the only 2 I've heard of where they're having access problems.
Let's see. This will be the last question, and we are out of time after that. On the application, I don't see a place for associate's degree for dental hygiene. Would this degree be considered?
Dental hygienist is an eligible program. In answer to the access question, you might want to be using a Windows. The system is not favorable to Apple for whatever reason. So you want to definitely be working on a Windows laptop or computer. That might be that might be what the issue is.
Yeah, maybe try different browsers as well. Okay. Well, thank you all for your participation in the question and answer session. Amazing questions. You guys had a lot of great questions, and we hope that we answered them all. If you still have questions after this, please email the team at hwdd sch@hcai.ca.gov. As a reminder, we will post the recording of this webinar, all of these question sessions, and the slide deck is on our website in approximately 7 to 10 business days. And I'm going to hand it over to Hovik for some closing thoughts.
Hey, Chris. So yeah, just wanted to thank everyone. There's a lot of questions. So I hope everyone takes note of the email addresses, and it's great for everyone to really share their contact info for our office. Please, don't hesitate to contact us, email us. We're always here to help. So I know there's a lot of questions, probably many more that you'll probably think of as you apply. So we just want to be here to help you and answer any questions. So thanks again, everyone, for attending. Really appreciate it. It was a great turnout, and looking forward to supporting everyone, hopefully, that is in this session, and that'll apply for the program. Thank you.
All right. Thank you, Hovik. Well, we appreciate everybody joining us today to learn more about the Allied Health Scholarship Program. We are excited to be able to offer workforce development efforts at HCAI. Your participation with us today. We have some resource slides here, and the camera was not working. Sorry about that. You can follow us. Obviously, we've mentioned our website. Please check out the website. You can follow us on Facebook, LinkedIn, Twitter, and YouTube also to get more information. And you can see some hashtags that we commonly use as well right there. And then we talked about signing up for our email list. And on this next page here, we highly encourage you to sign up for our newsletter. Go to this link right here, and you can sign up for our our newsletter. What you want to do is sign up for the health workforce updates. You can sign up for funding opportunities and all of that. When you sign up for that, that will get you on our list, and you will find out about all of these amazing opportunities And so we ask that you sign up and share that. Additionally, you can contact us through the email that we shared, and also you can call us at 916-326-3700. As a reminder, the application cycle does close December 13th at 3 p.m. And so we highly encourage you to get it done early. Don't wait. And thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.